We have to look at the whole field of Medicare. These were the words of President Muhammadu Buhari during his inaugural speech in 2015. Since taking over the leadership position of the country in the last 1 year, the plan for the health sector seems to be looking more in the direction of universal health coverage, just as the government has tasted a bit of public health challenge and industrial action. In continuation of our review of the president's 1 year in office, our correspondent Yomi Otaigbe takes a look at the developments in the health sector.
The first test from the health sector for President Muhammadu Buhari's administration is the outbreak of Lassa fever in August 2015. This was made public in January 2016.
In the last 6 weeks, Nigeria has been experiencing Lassa fever outbreak, which so far has affected 10 states in the country.
These days, although the Lassa fever outbreak seems to be on the decline, statistics from the Nigeria Center for Disease Control show that 175 confirmed and suspected cases were recorded, with 101 deaths in 19 states since the outbreak began. As in previous administrations, the Buhari-led government has had to deal with threats and actual industrial action by health workers over lingering welfare and administrative issues, and the people have continued to bear the brunt.
Lives are not taken serious anymore here. These few strikes that they are going on now, believe you me, many people will die here.
The Minister of Health, who's been on board for about 7 months, says the focal point of President Buhari's administration for the health sector is universal health coverage on the basis of strengthening the primary health centers.
Some are uncompleted, some are dilapidated, some are overgrown with weeds. But what we plan to do is we want to make functional 10,000 of these 30,000 in the next 2 years. What will it take? We want to have one functional PC per ward. It's not a new idea. What is new is our strong determination to implement it. The plan is to do half this year and the remaining half next year. So from mid-2017 towards the end of 2017, Nigerians will begin to see the dividends of this effort.
Another fundamental issue that has plagued the health sector over the years is chronic underfunding of the system. With 250.06 billion naira out of the 6.06 trillion naira 2016 budget earmarked for the health sector, President Buhari's administration is also treading below the 15% agreed upon by African countries in the Abuja Declaration of 2001.
I believe that there is need to improve on that budgetary allocation, because if the budgetary allocation remains at 3.56, and then the universal health coverage we are talking of, the Consolidated Revenue Fund, National Health Act, all those cannot be accommodated within that 3.5% allocation.
I want government to be able to attain as high a percentage, like 60, 70, 80% universal health coverage for Nigeria, okay, by ensuring health insurance cover for everybody.
For an effective and efficient health sector in Nigeria, other areas the government needs to look out for and make amends include shortage of skilled healthcare practitioners, constant disharmony and incessant strikes in the health sector, and the implementation of the National Health Act, which has been described as the framework for the regulation, development, and management of Nigeria's health system. Yomi Otaigbe reporting for Channels Television News.
Joining me now on the news at 10 is Dr. Osaho Nabalele, who is a former national president of the Nigerian Medical Association and current Vice President, Commonwealth Medical Association. Doctor, good evening to you.
Yeah, good evening. Thank you very much for inviting me.
Give us your assessment of the healthcare sector in the last 1 year.
Well, 1 year in the life of an administration that has a 4-year mandate may seem too short to judge such an administration. But I would say within the framework of the promises they made, in terms of their pronunciamento to Nigerians, one can dialectically, situate their performance, even within the first year, within the framework of those promises. And if you do that, one will very unfortunately say that not much really has happened in terms of attuning themselves to, in terms of the government attuning itself to the promises she made to Nigerians. For instance, the issue of budgeting for health. I recall that one of the promises that elicited huge expectation and huge, very tremendous hope amongst Nigerians was the promise of the government to budget a minimum of 15% of the national, health of the national budget to health, and that was inspirational. That was monumental. That was fundamental. But again, here we are now, having a budget of 2016 allocated health allocation to health sector in 2016 budget of about 3.65%, which is even far below what we have reached in terms of averages, the average for the last 7 years, which is about 5.34%. So it's even far lower than what we've been having over the last 7 years. So clearly that has not been met. Secondly is the issue of the National Health Act. There was a promise in terms of their pronouncement to get the National Health Act, very much more aggressively implemented. But here we are, we have still not left the launch pad. So that certainly is not inspiring to a lot of Nigerians who had hope in the fact that within the first 1 year, some of these dividends of the health dividends of democracy will start getting to Nigerians. Again, it's the issue of access to care. Access to care still remains very poor, in fact less than 40%. And of course, in the face of a worsening economic situation, Nigerians are increasingly now indulging in what is called catastrophic health expenditures, leaving extra holes in their pockets for every health purchases they make. And that is not good enough.
But then there were pronouncements with regards, having universal health coverage and revamping the primary health care as well. What concrete actions do you think the administration should be taking in this regard?
Well, universal health coverage is not what you do in isolation of some fundamentals. There are certain fundamental requirements for you to achieve universal health coverage. One is the fact that you must have equitable access to basic minimum package of healthcare services. Secondly, you must have a well-motivated health workforce. You must have appropriate financing mechanism to, of course, promote universal health coverage. And, of course, the issue of health infrastructure, having very robust, well-managed health systems, and, of course, health infrastructure. And, of course, equitable distribution of skilled health workforce. So you need a concatenation of these factors to be able to drive the realization of universal health coverage. So for government to be able to do that, you must appropriately budget for health. Now, the National Health Act talks about a minimum of 1% of the Consolidated Revenue Fund of the Federation to be provided in the form of a basic healthcare provision fund, which is supposed to, of course, cater for some of these healthcare services in the rural communities, in the primary healthcare facilities. For instance, 50% is supposed to be provided for provision of services on the part of the NHIS, for National Health Insurance Scheme management of service provision. Then, of course, the rest 50% to serve for the supply side of the healthcare delivery equation in terms of provision of health human resource, in terms of provision of drugs, vaccines, and equipment, in terms of even emergency care. So that has not been provided in the national in the budget of 2016. So that means substantially that even universal health coverage in the next 1 year may face a lot of problems.
But
because
with the passage of the act, that should be ameliorated.
Yeah, but passing an act without providing for it in the budget is tantamount to having achieved. It's like achieving nothing. So that needed to have been done because you need appropriate financing to be able to drive universal health coverage. Again, is the issue of health workforce. You need a motivated health workforce to be able to drive universal health coverage because people are going to, of course, provide healthcare services. So universal health coverage is not only about building infrastructure or facilities, but of course the component parts of the health system. And that has to do with health human resource, which is very key towards driving universal health coverage in terms of the appropriate mix, in terms of this key component, the knowledge base, and of course the motivation and the remuneration of these health workers. Secondly is the issue of even the regulatory framework. Today, as I speak to you, all the health regulatory bodies in Nigeria are still in a state of dissolution. That cannot make for appropriate quality universal health coverage for Nigerians because universal health coverage also is predicated on quality. So how do you have quality without having a body on ground that will regulate the system in terms of the health regulatory bodies? We thought that the president was going to depart from the shenanigans of the past where regulatory councils for health were dissolved ad nauseum. That is still on now. Since July last year, these councils have remained in a state of dissolution. So who is checking quackery? Who is ensuring quality? So Clinical governance needs to be driven more appropriately by government, and they cannot do this unless they put the institutions on ground to ensure that these systems are well driven. Again, is the issue of what I will call the management system, because NHIS is a risk pooling mechanism. NHIS is what manages a risk pooling mechanism which Nigeria has since adopted as a way of fundamentally financing health services in terms of provision of access, provision of basic services to Nigerians. Now, NHIS has been in a state of doldrums, has been in doldrums for quite some time now. And you cannot have that and still expect to have universal health coverage. So the management of the National Health Insurance Scheme needs to be looked into, because you need effective supervision and monitoring to be able to, of course, ensure that the deliverables are being met, to ensure that the demands of Nigerians in terms of access to care is being met.
What do you think Nigerians want right now in the very short to medium term? What should be the immediate things that should be addressed as this administration starts its second year in office?
Well, first is to ensure that Nigerians have tremendous access to tremendous financial and geographic access to healthcare services. Nigerians, and that means addressing the state of poverty amongst Nigerians, because a man that is poor cannot access health. And I think we need to be very conscious of the fact that, look, there is a very strong nexus between health and economic prosperity. There's a very strong nexus between health, productivity, and development. So the Nigerian government must massively invest in the needs, the welfare, and of course the prosperity of Nigerians. Today, as we speak, the economy is going down the drain. And that means that even the purchasing power of Nigerians is being undermined. And that has tremendous impact on access to care. So Nigerians, a lot more Nigerians are now unable to even subscribe to the National Health Insurance Scheme, which unfortunately just now is still providing less than 5% in terms of the coverage rates. Whereas countries like Rwanda can boast of a coverage rate of over 90%. South Africa, over 68%. Ghana, over 64%. Nigeria is talking about 5%. So there is need for a surgical dissection and dialectical analysis of the situation on ground.
Dr. Nambulele, thank you so much for coming on the news.
Thank you very much. Thank you.
When the News at 10 returns, the agony of a family in search of their loved one who's gone missing for over 3 weeks. Join us again.